Hi, welcome to this COVID-19 Teletown Hall hosted by the Virginia Department of Health. I'm Maria Almond. I'm the District Director for the Piedmont Health District with the Virginia Department of Health. We serve 7 counties: Amelia, Cumberland, Buckingham, Prince Edward, Charlotte, Lunenburg, and Nottoway. Today, we are very excited to have with us Dr. Josh Jakum. He comes from Warrenton. He's a practicing pediatrician there. And as we move forward with COVID-19, we are so lucky to have 2 things that keep us going: vaccines for those who are 5 and older, and treatments. We are understandably waiting anxiously for those vaccines for the very youngest of our population. And there are lots of questions and concerns we have for all of our children as we move forward. Let's give a good welcome to Dr. Jakum. Thanks.
Thank you, Dr. for the introduction. Hello, everyone. Thank you for joining us today as we present our Teletown Hall on what you need to know about COVID-19 and the COVID-19 vaccines. Currently, COVID-19 cases are climbing again, and the U.S. has hit a grave milestone of over a million COVID-19 related deaths since the beginning of the pandemic. Virginia has done a great job in getting people vaccinated. However, we must stay vigilant in these efforts to keep the Piedmont community safe and healthy. In today's webinar, we will be sharing with you facts about the vaccine, COVID-19 implications for children and teens, information on booster shots and additional doses, COVID-19 treatments, and frequently asked questions. And if you have any questions today, please enter them into the question and answer box. You can find that on the left bottom side of the screen. And we hope today's webinar leaves you feeling empowered to make informed decisions about COVID-19 vaccinations for you and your family. To do a brief introduction of our panel today, I'm Sammy Clark, and I am the Central Regional Coordinator with the School Support Unit, and I will be today's host and moderator. I received my Master's of Public Health from the University of Michigan and have spent the last 8 years working in the field. I am passionate about improving the overall health of minority and vulnerable populations by addressing the social determinants of health, conducting research, and using data to drive policy changes. We're also joined today by our subject matter expert, Dr. Joshua Jakum. Dr. Jakum is a board-certified pediatrician currently servicing children and families at Piedmont Pediatrics. Dr. Jakum graduated from the University of Maryland and completed his medical degree at Emory University School of Medicine. He completed his internship and pediatric residency at Brown University School of Medicine and joined Piedmont Pediatrics in 2003. Currently, he is a faculty member of the Virginia Mental Health Access Program, clinical professor at VCU School of Medicine, and is a fellow of the American Academy of Pediatrics. His interests include medical ethics, concussions, and travel medicine. Dr. Jakum currently lives in Warrenton, Virginia with his wife and children, where he enjoys beekeeping and gardening in his spare time. We also have a special thank you to Dr. Maria Almond, who is the health director at Piedmont Health District. Thank you all for joining us today. Next slide. All right, before we begin, vaccination is a personal choice. Our goal is to empower you with accurate, up-to-date information on COVID-19 and the vaccination to make the choice for yourself and your family and address common COVID-19 concerns. VDH strongly encourages to trust the advice of your medical health care providers. Vaccination is recommended by the Virginia Department of Health, Governor Youngkin, the American Academy of Pediatrics, and the Centers for Disease Control and Prevention. Where do we go from here? Although we are entering a new phase, COVID-19 is not going away. That means that communities are still at risk for getting COVID-19. We don't know what person with COVID-19 will get very sick or develop long-term problems like long COVID. COVID-19 is unpredictable. Getting yourself and your family vaccinated now is the best way to protect them from getting very sick. Next slide. And so to get us started, we have a short clip from one of our healthcare providers in Southwest Virginia who will be sharing her testimony on the COVID-19 vaccine.
My name is Sarah Seeley Dick. I'm a general pediatrician here in Abingdon. I am a risk-averse person. I don't like to take extra risks. Driving your car is far more dangerous than getting the vaccine, and yet we do it without thinking about it. But when we drive our vehicle that we know can be dangerous, we wear our seatbelt. And I always wear my seatbelt, and I make sure my children wear their seatbelt because I want them to be protected. I think of the vaccine as that one extra layer of protection for my child.
Yes, let's move forward together, Virginia. I will now be passing it over to our subject matter expert, Dr. Jakum, who will be sharing with us today his knowledge and expertise on COVID-19 and the COVID-19 vaccinations.
Thank you so much, Sammy. I really appreciate the introduction. So I want to hit on a number of things, and as Sammy mentioned, there's an opportunity for you to submit questions, but I want to start with some facts about the COVID-19 vaccination. And these are questions that I'm often asked, and I want to dispel myths, and we're going to do that throughout these slides. So the first is that the benefits of the vaccine far outweigh any potential risks. And that's why the CDC recommends the COVID-19 vaccination for everyone who's going to be 5 and older. And we're happy to say that very soon we anticipate additional vaccines coming for the 6-month-old to under 5-year-old population. Most importantly, you cannot get the COVID-19 vaccine illness from the COVID-19 vaccine. What's important is that the FDA has authorized something that is not a live virus. In fact, these are mRNA vaccinations for the population that I'm going to take care of, which is the under 18. And while there are some short-term side effects, which we're going to touch upon in a future slide, these are limited and they are so mild that getting COVID-19 far outweighs any risks. The second is that these vaccines were not made to the standards that the FDA has created. I often tell my families that compared to the rest of the world, the FDA, the Food and Drug Administration, is really the gold standard in the world when it comes to the quality of oversight and scientific process and analysis compared to just about any other country. And for that reason, there's no aspect of this vaccine that was rushed. Quite the opposite. We have been building with decades of research, not just on vaccination and understanding illnesses such as the coronavirus, which is what causes COVID-19, but also the mRNA technology that we're now harnessing in these newest of vaccines. Third, that COVID-19 vaccines protect your health. Well, we know that people that are up to date on vaccination, specifically in this example, COVID-19 vaccination, are much less likely than the unvaccinated persons to not only acquire COVID-19, but also to develop the complications of hospitalization, long COVID, complications of the illness itself, and sadly, death, as we've now struck the very grim milestone of 1 million deaths in our country. The fourth is that there's a cost for these vaccines. I want you to understand that thankfully, because of the leadership of our prior administration and our current administration, the vaccines are actually free to all individuals. You do not have to pay. And so because there's a zero cost out of pocket, please don't let the thought of the cost be a barrier for why you would get vaccinated. And most importantly, this is the fifth point that I really hope that you come away with today, and that's the vaccinations significantly lessen the risk of serious complications. We know that these vaccines reduce the likelihood of you getting the illness. If you are going to get the illness, and I'll be honest that the vast majority of us are going to get COVID-19 at some point in our lifetime, if you get this illness, you are much less likely than an unvaccinated person to get the illness, transmit it to somebody else that you love, and coworkers, family, friends, neighbors, as well as the significant reduction for developing long COVID, being hospitalized, having long-term complications of any sort, as well as death. Next slide, if you would, please. Because I'm a pediatrician, I want to touch upon the very specific aspects of how COVID-19 affects the life of a child. We've been at this battle with this illness now as a pandemic for 2 years. And there is no doubt that the lives of children, the people that are in your home and in your community, in your schools, have been impacted. And so we know that there is going to be educational, social, and physical limitations that have developed because of the alterations of our society. But very importantly, I want you to understand that COVID-19 does pose a serious risk of illness and hospitalization for children. During the most recent Omicron surge, we saw that children were hospitalized at a higher rate than at any other time throughout the pandemic. And even though the vast majority of children are going to survive the illness of COVID-19, we know that there are complications both in the very near experience of the illness as well as throughout long-haul COVID. And so the risk to the older unvaccinated age groups cannot be undersold. Please understand that long-term illness exists. And there is a very unique phenomenon known as MIS-C, which stands for multi-system inflammatory syndrome in children. And this is different than long COVID. We know that several weeks after the onset of the acute phase of the illness, that a small population of children are at remarkable risk for hospitalization, resulting in organ failure, and the possibility of death. So please know, I don't know yet scientifically which of those children are at greatest risk for the developing the MIS-C or long COVID, and we hope to unearth that information over time, but vaccination distinctly is the best way to protect your child so they do not have these very serious complications and that they can get back to their everyday routines. Next slide, if you would, please. Additionally, there's this phenomenon known as pericarditis and myocarditis that I will be honest, that most of my families had probably never heard of, even though I'm trained and Dr. Allman is trained in medical school and in our residencies to understand this diagnosis. This is a unique phenomenon that there can be inflammation of the outer lining of the heart in pericarditis, or actually inflammation of the heart muscle itself in myocarditis. And while it is rare that COVID-19 vaccination can cause that, I want to be clear that the COVID-19 illness is up to 100 times more likely to cause pericarditis and myocarditis. And so for that reason, because the risk to you is so very low from the vaccine, and that we know that if you have that complication of pericarditis and myocarditis, it is self-limited, meaning it goes away on its own in a matter of several days. And additionally, there are no reports of death from pericarditis or myocarditis from the vaccine, but there are complications that are much longer in duration and severity from the illness. We highly recommend vaccination. The CDC and your healthcare workers are going to continue to actively monitor the reports, and we're going to learn what those complications are and who those individuals are that are at greater risk. We know that those are young adults and late teenagers that have the greatest risk from ages 16 to 39. And we are going to potentially alter how we recommend the administration of the vaccine as we gain more data. At this time, however, vaccination is by far the greatest thing that you can do to prevent the very illness that you might be worried about. Please, next slide. So a lot of times people ask about the side effects that may occur with the vaccination. What I tell my families is that the side effects are exceptionally limited in their duration, meaning it's a very short period of time that you may experience it. And these are side effects and aspects of the illness that really can be managed very easily with rest and things like ibuprofen. You might have pain or redness or swelling where you get the vaccination, and throughout the rest of your body, you might feel a little tired, fatigued, headached, or have muscle aches, a brief fever, or even feel nauseous. But again, the side effects are going to be very short compared to the side effects of the illness itself, which can last much longer. Please, next slide. So touching upon a number of the myths that unfortunately families hear on social media or through news media, print or online, I want you to understand that there are a number of things that are circulating out there that are just simply not true. The first is that the vaccine could possibly hurt the potential for you to become pregnant in the future, whether it's through disrupting fertility or impacting the sterility for any short period of time to a young adult. There is absolutely no data that that is true. And in fact, the Centers for Disease Control has taken on a massive study to look at the possibility that any portion of that could be true. Thus far, we have not had any data to really support that. The second is that the vaccines possibly contain any fetal tissue. Again, this is a myth. That vaccines could possibly affect the DNA or alter your DNA in some way. And that's in part because most people, unless you remember your biology class in high school, most people have not thought about something called mRNA since they were in science class in high school. Well, I want to please have you understand that the science exists, that while we are putting a small amount of genetic instructions in the vaccine, this does not impact your DNA in any way, nor does it alter your DNA in any way. Lastly, if you were to be vaccinated, you become more vulnerable to contract COVID-19 due to the vaccine, or that there's dangerous ingredients. Again, please understand that the FDA has taken the most serious of rigorous steps to monitor the manufacturing and the use of these vaccines, and that none of these things are true. Please, next slide. We're going to do a quick video that's going to explain a little bit about the history of vaccinations as well as the COVID-19 vaccine itself. So please start.
Hi there, I'm your COVID-19 vaccine. You might think I'm new, but I'm only here because decades of scientific research and clinical trials made me possible. When Edward Jenner discovered the first smallpox vaccine, George Washington was president. And scientists have been continuously improving vaccines since then. For instance, do you know anybody who recently got polio? The polio vaccine basically wiped that disease off the US map. So, next time someone says I'm too new to be trusted, remember, researchers around the world have been building on the science that made me possible since long before you were born. And when science says you need a booster to help me stay effective, that's been tested too. And it's not just for us grown-ups. All that research and testing show that kid-sized vaccine doses for younger children are also safe and effective.
Not so fast, Jack.
So let's move forward and get vaccinated, Virginia.
So let's take a couple minutes just to talk about not only the COVID-19 vaccine, but also the instructions of how I would recommend that you receive the vaccine. The first is that there is now, as we enter this new phase of the pandemic in our country, and many people have received their initial series of 2 vaccines and possibly even a third, the Centers for Disease Control is actually recommending that those that are moderately to severely immunocompromised receive an additional dose. Now, sometimes this will be your 3rd dose, but it may even be your 4th dose. And this is going to include people who have active cancer treatments ongoing, those people that have a history of an organ transplant, or might take things to suppress their immune system, such as a steroid. It might be people who have had a stem cell transplant, or it's going to be people that have HIV illness and are under treatment for moderate or severe primary immunodeficiency. Next slide, if you would, please. As I alluded to, for booster shots or second booster shots, and again, like I said, as we enter into the next phase of the pandemic, we're learning that we have to narrow down the groups that should be receiving the vaccine. First of all, in my patient population of pediatrics, everyone 12 and older should have a first booster. There's different ways of looking at this, whether or not this 3rd dose, so we've had the first 2 of the primary series, and this 3rd, was that really part of it, or is it a booster? Doesn't matter what terms we use, but I want you to know that those individuals that are 12 and up and should all receive a booster, but especially those people who are with moderate or severe immunocompromised states and who have had their last dose of that 3rd dose, the first booster, 4 months ago, should receive a second booster. Those people that are 18 and older who have had both that primary series of 2 shots or a single shot of the J&J Janssen at least 4 months ago should definitely receive that 3rd shot. And if it's been 5 months since you completed the primary series of vaccinations, you're also eligible for that next dose. And it doesn't matter whether or not it's the Pfizer BioNTech or the Moderna. If you're 18 and over, please consider getting the vaccination. Those individuals, though, that are 12 to 17, so again, the patient population that I care for, they're only eligible for the Pfizer BioNTech. Next slide, please. Older adults now are able to receive a 4th or 2nd COVID-19 booster dose. If you're 50 years and older and you already completed the initial 3 primary series plus the 1st booster, and it's been at least 4 months since you received that 3rd booster, you're eligible for that 4th booster. Right now, that's recommended because we anticipate increasing rates of COVID-19 illness in our community as we're seeing rising hospitalization rates and we see increasing numbers in different populations. Next slide, please. Most importantly is that there are many new treatment options that have come to the marketplace. And this is where I'm going to say, if you're one of these individuals that could possibly meet the criteria of more likely to get sick from COVID-19, please make sure that you're going to communicate with your primary care physician, whether you're internist, your family practitioner, your nurse practitioner, or PA. There are a number of people who are at high risk for the progression of serious disease. And the FDA has issued clearance for a number of different and unique treatments. These include monoclonal antibody treatments, which are going to be infusions after you know that you have the illness. This might be the oral antiviral medications that are specifically targeting populations of individuals that could have the illness before they're exposed. And the thing to understand is that sadly, now that we've gotten through the Omicron wave these last 3 months, some of these treatments are not necessarily going to be effective. And that's where I want you to turn to talking with your individual healthcare provider to see which of those treatments are most appropriate for you. Next slide, if you would, please. So how do you know if you're one of those individuals that should be talking to your physician? Well, I'm going to say, first of all, the broad brushstroke, if you're 65 and older, I want you to be having regular conversations with your clinicians. That your primary care healthcare provider is going to know you the best and going to know whether or not you have an illness or an underlying disease or risk factor. But if you're somebody who's compromised with your immune system in some fashion, whether that means that you have a history of a transplant, if you're undergoing current chemotherapy, or if you have an illness such as HIV, which chronically reduces the likelihood of your immune system to respond, you're going to be, no matter what your age is, somebody who's going to be at a greater risk. And chronic diseases, again, doesn't matter what age you're at, whether it's things involving your heart, liver, lung, or kidney, if you're somebody who's had a transplant, like I mentioned, if you're overweight or obese, have something like sickle cell disease, diabetes, if you're pregnant, these are all things that put you at greater risk. And I want you to take seriously, have those conversations with your physician, your nurse practitioner, your PA, so that you can determine, are you at somebody that should be contacting them regularly and possibly getting additional treatments? Next slide, if you would, please.
Is the COVID-19 vaccine safe?
Yes, the COVID-19 vaccine is very safe. It's been tested in many trials by different pharmaceutical companies, and it has been approved by the FDA for use in the United States.
Some of the common side effects that we're seeing with the COVID-19 vaccine are some general body aches, low-grade fevers, a little bit of a headache. Those are nothing compared to contracting the COVID-19 virus.
Was this vaccine rushed? The COVID-19 vaccinations were not rushed. They went through every clinical phase that they were supposed to, but the vaccine was absolutely not rushed.
How do we know the COVID vaccine will be effective? So there have been large studies looking at groups of individuals who received the vaccine versus groups of individuals who didn't. Those who received the vaccine were 95% less likely to develop COVID-19 after receiving it.
So I really like that video because it hits a number of frequently asked questions, but I want to touch on a few of those because those might be the questions that you right now have in your mind. Or if you have additional questions while I'm talking right now, please put them in the chat box because we're going to end with those questions that you have out there because I want to certainly hit upon them. The first is, do you need to get vaccinated if you might not get very ill from the COVID-19 illness? So I'm asked that a lot because, of course, as I take care of kids and kids get viral illnesses a lot, parents say, is this really appropriate for me? And what I want you to understand is that there's two massive reasons why I want you to get vaccinated. The first is that I don't know if you're going to be one of those individuals who tragically has a serious complication. I've lost patients in my practice to COVID-19. I've lost children to this illness. And while some of the individuals may have chronic underlying disease, and we know they're at their greatest risk, sometimes it's very healthy individuals who can have very serious complications. And what I do know is that being vaccinated is the single greatest thing you could do to reduce complications, hospitalization, long COVID, and the possibility of death. That's why I recommend vaccination. The second frequently asked question is, can you get other vaccinations at the same time that you receive the COVID-19 vaccine in my office? And I'll tell you with a resounding yes, I give multiple vaccines at the same time because the COVID-19 vaccine is so safe that I can give standard childhood vaccinations that patients get at their well visits. I can give seasonal vaccinations like influenza, and I can also give travel vaccinations if you're going to go out of the country. So vaccines can be given at the same time with the same effectiveness. Another question is, what are the different types of COVID-19 variants? Well, you may hear what I affectionately call the alphabet and numeric soup, the BA1, 2, alpha, beta, Omicron, all these different things that you're hearing. Well, that's used as scientists that we actually use those terms so for quick ways to communicate amongst each other. And what I would say is you don't have to worry about the alphabet and numeric soup of what letter or number of illness is currently out there. What I want you to understand is that getting vaccinated is going to be the single most effective thing to keep you healthy. And if there are variants that the vaccine is not as effective at conquering, well, then it's up to us as physicians, nurse practitioners, PAs, pharmacists, researchers, and your elected leaders to find ways and the resources to keep you safe and healthy. And that might involve additional vaccinations in the future. It also might involve things like the monoclonal antibodies and the oral antivirals that I talked about earlier. We're going to be fighting this virus for the rest of human history. I often say that the genie is out of the bottle. I can never put it back in. And for the rest of our lives, we'll be dealing with some aspect of COVID-19 and the illness that it causes. And what you can do is find ways to protect yourself. And lastly, how soon after testing positive can you get vaccinated? Well, while I don't want you to have the illness, what I can say is as soon as that you are well without fever and generally 10 days from the onset of your illness, you can get vaccinated. And while it may seem strange, but after you've had the illness and survived COVID-19, getting vaccinated enhances, improves the antibodies that your body naturally produces. So while I want you to get vaccinated before you have the illness, I will tell you that if you've already had the illness, you're still at risk for getting COVID-19 a second, third, or more times in the rest of your life. And so for that reason, please get vaccinated, improve the antibodies that your body has already produced so that you're healthier and safer for the future. So, Sammy, if we can move on to just the questions that have come in while we've been talking. I thank you all for being so patient with me, and I love the videos that the Virginia Department of Health and the leadership of your health district have put together. But let's hit some of the questions that you might have that I can answer specifically.
Sure, thank you, Dr. Jakum. And as Dr. Jakum said, we really do encourage all questions, so please share any questions you have in the chat box. But to get started, our first question has a couple different parts to it, so I'm going to read the whole thing, but let me know if you need me to repeat. What does long COVID mean for children? What is the percentage of children who have long COVID? Where do I receive treatment for my child if they have long COVID, and what treatments are available?
Oh boy, there's so much to unpack in that one. Okay, so we're still determining as researchers and scientists, and in this example, pediatricians and family practitioners, we're trying to determine what does long COVID look like in a pediatric population compared to what it looks like in the adult population, because we know that it's going to be different thus far. I'm a pediatrician, but taking care of a 2-month-old versus a 2-year-old versus a 12-year-old, or sometimes a 20-year-old in my practice, those are 4 very different patients that show up and need my care. And so long COVID looks very different for each of those. Sometimes it might be inflammation of the heart, like we talked about, which can happen after you have the virus and you have the illness. It can be neurocognitive slowing, which means the cloudy brain or the COVID fog that many adults report. It can be shortness of breath. So what that's going to mean for different populations and whether those individuals are vaccinated or not, I know that it's those long COVID symptoms are reduced if you've been vaccinated prior to the illness. But what it's going to mean, I'm still going to have to wait to tell you all the different nuances. And that's why I want you to talk to your physician. As far as the availability of long COVID resources in your community, what I can say is that right now, research centers and academic centers and the leaders of your community are starting to put together unique clinics to deal with long COVID. In Charlottesville at UVA, in Richmond at VCU, we know that those researchers and medical leaders are starting to put together comprehensive clinics that are going to start looking at how to care for individuals that are suffering from those long symptoms. What was the other parts of that? I'm trying to make sure I answered everything. Sammy, what else did I not hit?
Let me just double check. So what is the percentage of children with long COVID? Where do I receive treatment for my child if they have long COVID, and what treatments are available?
So I think I pretty much hit most of it. The biggest one is going to be prevention, and I can't strike that enough. Getting vaccinated before you have the illness is the greatest effect to improve your outcome for long COVID.
Okay, great. Thank you. Thank you, Dr. Jakum. So we have a question from Ms. Fender. She says, I am a school nurse and I often hear regarding COVID vaccination what I often hear regarding COVID-19 vaccination is, but my uncle, cousin, wife, dog got the vaccine and still got COVID. So why should I get vaccinated since the vaccine doesn't work? Do we have any additional tips or tricks to combat this?
Ms. Fender, first of all, I want to thank you for your commitment to our schools, because you are even more on the front line than I am. And I have a massive special place in my heart for school nurses. So first of all, thank you so much for your dedication to the patients and the children in our community. Regarding how to demystify getting COVID despite being vaccinated, what I really strike with my families is the fact that things could have been so much worse if they were not vaccinated. What I talk about is that I like using the examples of Dr. Sealy Dick used it as driving in a car. I still put on my seatbelt, and I still make sure I purchase a vehicle with airbags, and I still am going to use my blinkers, and I'm going to turn on my headlights in the rain. I'm going to do all these things to prevent a serious outcome. And so the reason to vaccinate is that for those individuals currently in our country, and it's very sad, the vast majority of the deaths that are still occurring in our country are in the unvaccinated population. The individuals who are experiencing inflammation of their heart with the myocarditis, they're 16 times more likely to develop myocarditis if they are unvaccinated. And the individuals who have long COVID are the individuals, vast majority, who are unvaccinated. So while I know that I'm eventually going to get COVID-19 and the people that I love are going to get COVID-19 illness, I'm going to do everything to prevent a serious outcome. And if I'm in a car accident and I'm wearing my seatbelt and I've got airbags and I still had my headlights on, and yet I still had that accident, I know that my injuries are going to be much less severe and I'm much more likely to survive that accident than being ejected without wearing my seatbelt, striking a windshield and injuring myself, and being hospitalized for a much longer period of time because my injuries were much more severe. So I'm grossly graphic sometimes with my families to say that the things that we do on a daily basis, and I'd even encourage you to look at old videos from the 1980s when we first started to mandate people having to wear their seatbelt. And you're going to find that the complaints that existed in the 1980s for why people didn't want to wear a seatbelt are actually the same complaints that I often hear for why somebody doesn't want to get a vaccine. So I'm here to protect the health of our community as you are in the school system. So don't be afraid to say that you care and love that individual, and that's why you want them vaccinated.
Thank you, Dr. Jakum. So our next question is, which vaccination do you recommend, Pfizer or Moderna, for ages 5 to 11? And how long should I wait in between doses?
So right now, the answer is really simple because the only option is the Pfizer BioNTech vaccination for ages 5 to 18. The Moderna vaccination is only recommended for 18 and up. So Pfizer can be given to anybody 5 and all the way through adulthood, but at this current time, Moderna is only available to those individuals 18 and up. Now, we know that's going to change in the very near future. So the quick answer is you only have Pfizer. As for the duration, currently, the recommendation is 3 weeks between the first dose and your second dose when it comes to the Pfizer vaccination. There is an allowance for up to 8 weeks to wait between those two doses for those individuals who are particularly concerned about the risks for myocarditis and pericarditis. What I would say is when we're in the middle of a pandemic and I know that this virus is actively circulating, my encouragement is get the vaccine. If we are successful in reducing the likelihood of the illness and the spread of this virus in our communities, then I would feel a little bit more comfortable with individuals waiting perhaps more than 3 weeks. But right now, when we're actively seeing this illness, please get the vaccine.
Thank you. Okay, so next up we have, since about 60% of children have been infected with COVID-19, why should I get my child vaccinated now?
So great question. We know that with the Omicron surge, that at least in the Commonwealth, in our state, we saw a massive spike from about the 3rd week of December until the 1st to 2nd week of March. And since that time, while I'm very happy that we've seen a significant reduction in illness, and there was a disproportionate number of children getting ill. It was absolutely wildfire running through our community. And while the vast majority of those individuals survived the illness, I'm now addressing long COVID. A number of my patients were hospitalized. A number of them have complications like respiratory symptoms, shortness of breath, and we're still figuring out the neurologic effects on learning and the impacts it's going to have for an uncertain amount of time. So the reason that I want you to be vaccinated is because those individuals that were vaccinated had less symptoms, were less likely to spread it to the next individual, whether that be a classmate or a family member, parent, grandparent, loved one, neighbor, as well as those individuals are more likely to survive and not die. So while, yes, we had a horrendous surge of Omicron, and many, many people got the illness. Not everybody did. There are going to be more variants that are going to come and attack us. You'll hear me say it over and over. The genie's out of the bottle. COVID-19 illness, this virus, is with us for the rest of human history. And so with that in mind, I'm looking for the next time that your child is going to get ill. I'm looking at the next loved one who's going to succumb to COVID illness. That's why I want you to be vaccinated. It's not for what's in the rearview mirror. It's what's on the horizon, which I'm still yet uncertain what it's going to entail.
Thank you. And so our next question is, when will baby Pfizer be available, and why has there been a delay?
So I love that term, baby Pfizer. I had never heard that before. So baby Pfizer, which that is referring to the vaccine for 6-month-olds through 4 years old, but not the 5 and up, because the 5 and up we know has already been released. So I will tell you that in 1 month's time from the time of the taping of this webinar, we anticipate on the 10th of June that the leadership at the Centers for Disease Control's subcommittee, the ACIP, the American Committee for Immunization Practices, is going to be meeting to look over the data. It's a very unique phenomenon that we have different doses of a vaccine for different age groups. That's not always the case. For example, there are vaccines that I give that are the same dose, whether you are 2 months old, 6 months old, 12 years old, 22 years old, or 62 years old. It doesn't matter. There are vaccines that are given. But with the COVID vaccine, and I'm referring specifically to the mRNA vaccinations now when I'm referencing the Pfizer, there is an adult dose, which is for the 12 and up. There is a childhood dose, which is 1/3 of a dose of Pfizer for the 5 and up till 5 to 11, I should be very specific. And so this 6-month-old to 4-year-old dose, the initial research showed that the 6-month-old to 2-year-olds, it was effective, but for the 2-year-olds into 5-year-old, it wasn't as effective. So we have now had to go back and realize there might need to be 3 doses in that primary series instead of the 2 that we anticipated. And so because we as pediatricians and you as the loved ones caring for children are so conservative about making sure that we never harm a child, quite the opposite, we want to give the best protection possible. We went back to the science, and the science said, we have to relook at this, and we might need to give, like I described, 3 initial doses. And so that's actually why there's been a delay. I know that everyone's waiting for that because people who are sending their children to preschools and to daycares, I want to protect those individuals. I want to protect those families from having COVID-19 in your home. And I also want to give you something that's quality, that's doing the job that it sets out to do. So wait, just a couple more weeks. It's about a month away.
Great, thank you. We have a couple more questions. So what are the quarantine isolation recommendations for young children diagnosed with COVID-19? Do they still need to wear a mask?
So I'll kind of distill it down to the most specific. The rule of thumb is from the start of your symptoms. So the first day that you were symptomatic, not the first day you were exposed, the first day that you were symptomatic, and also not the first day you were tested positive. The first day of symptoms starts day 0, 5 days of masking, 5 full days of masking. And at the 6th day, if you can wear a mask to fully encompass the nose and the mouth, to seal nicely around your face, you can go back into the community for days 6 through 10, wearing a mask and returning to school and returning to activities in the home. What this means is if your child is so young, let's be honest, a 2-year-old who cannot wear a mask reliably, you should stay home for the full 10 days. So just to repeat, if you are confirmed positive or presumptive positive by your physician, days 0 through 5, full 5 days, please wear a mask and in the home and do not leave the home. Days 6 through 10, wear a well-fitted mask, return to your community if you can reliably wear a mask. If your child is too young, special needs, unable for whatever reason, for a medical reason to wear a mask, you need to stay home the full 10 days.
Thank you. So someone asked, my child has alpha-gal. Does the COVID-19 vaccine have gelatin in it?
It does not. The mRNA vaccinations, the Pfizer BioNTech does not have latex, does not have gelatin, does not have dairy. So you can, while we have a lot of tick bites in this community, and we have a lot of tick-borne illnesses, and alpha-gal is a phenomena of being bit by a tick. This vaccine is not contraindicated for individuals with a history of alpha-gal.
Thank you. And then the last question we have is, if my 12-year-old does not have a booster, does he or she have to quarantine if exposed?
So the answer is yes. If your child is a confirmed exposed to an individual with active COVID-19 illness, and they are unvaccinated, they do need to quarantine. And I want to clarify quarantine versus isolation. Quarantine means that you're an individual that we suspect might be at risk for the illness, versus isolation, which means I know you have the illness and I need to keep you away from other people from actively transmitting the illness.
Great. So I think that wraps up our questions for today. Thank you, Dr. Jakum, so much for answering our questions. And thank you to the audience for joining us today. To schedule an appointment for you or your child, please visit vaccinate.virginia.gov or call 877-VAX-IN-VA, which is 877-829-4682. Again, that's vaccinate.virginia.gov and 877-VAX-IN-Virginia. Again, thank you everyone for joining us today. Stay healthy, Virginia, and take care.